This is an educational and informative video for an interesting condition where heart is situated on right side. This video is mainly aimed for medical students, doctors, and to some extent for education of general public. We all know that heart is normally situated on left side of the body, but there are some cases where heart is found to be on the right side. This is called as dextrocardia. Dextrocardia is many times associated with a condition called as situs inversus. It is present in 1 in 10,000 or approximately 0.01% of the population. Situs inversus is a condition where all organs in the body, including heart, liver, and spleen and intestine, are present on opposite side as compared to the normal side. Factors which predispose for the development of situs inversus include family history of cardiac defects, non-cardiac anomalies, diabetes in parents, use of cough suppressants or tobacco during pregnancy. It's a primarily genetic disorder involving the genes associated with movements of cilia. So it is a ciliary dysfunction disorder. It's an autosomal recessive disorder. Autosomal recessive disorder means the parents are unaffected but they are carrier. So even if the parents are asymptomatic, they can still transmit the disease to their children. In transmission of autosomal recessive disorders, usually 25% of the children are unaffected, 25% of the children are affected, and remaining 50% of the children are unaffected but they are carriers like their parents. This is a graphical representation of dextrocardia where heart is found to be situated on right side of the body and lungs are reversed. The right lung is bilobed and left lung is trilobed. Situs inversus and dextrocardia are usually asymptomatic, but there can be involvement of other organ systems. For example, in involvement of heart, there can be tetralogy of Fallot, transposition of great vessels, ventricular septal defect, pulmonary stenosis, or even double outlet syndrome. When lungs are involved in situs inversus, there can be cartagener syndrome, where due to inability of the cilia to push out mucus from the lungs leads to multiple episodes of pneumonia and lower respiratory tract infection. These patients can also have primary infertility due to ciliary dysfunction in fallopian tubes and sperms. These patients have difficulty in depth perception leading to disturbance in binocular vision. This is due to reversal of normal macular position in both eyes. So how will you know whether your child has dextrocardia or situs inversus? A child with dextrocardia or situs inversus will show some problems during childhood like cyanosis, breathing problems, failure to grow, no weight gain, frequent infections of lungs, jaundice, anemia, etc. Such patients are usually diagnosed with a routine chest x-ray done either for routine evaluation of a fever or specifically for lung infections. This is an X-ray of patient with situs inversus and dextrocardia. Here we can see that heart is positioned on right side of the chest cavity. This is further verified by position of aortic knuckle on the right side instead of the left side. Here is a comparison of chest x-rays between a normal patient and a patient with dextrocardia. In a normal patient, the heart is on left side as indicated by yellow arrow, and in a dextrocardia patient, heart is on right side as indicated by red arrow. In a normal patient, aortic knuckle is on left side as indicated by yellow arrow, and in a dextrocardia patient, aortic knuckle is on right side as indicated by red arrow. Similarly, there is reversal of mediastinal shadows in a normal and a dextrocardia patient due to changed position of heart. Additionally, in this patient with dextrocardia, we can see a pneumolytic patch in the right mid and lower zone. Apart from dextrocardia, we can also diagnose situs inversus on chest X-ray. As explained earlier, situs inversus is associated with reversal of normal positions of all the organs in the body. So on a chest X-ray, liver shadow is found on left side and not on right side. Stomach air bubble, which is normally situated below left hemidiaphragm, is found to be below right hemidiaphragm in situs inversus. This is additionally confirmed with a tip of Ryle's tube visible in the stomach air bubble below right hemidiaphragm. Situs inversus can additionally be confirmed with a CT abdomen. In a patient of situs inversus with CT abdomen, we can see that the liver shadow is situated on left side, spleen is situated on right side, and there is reversal of position of aorta and inferior vena cava. Situs inversus and dextrocardia are diagnosed incidentally, and so their management involves treatment of specific problems. Genetic counseling plays a very important role to decide whether future offsprings will be affected by this disease or not. Thank you for listening. Like and subscribe our channel for more educational and informative content. Thank you.